person-centered preventive healthcare model medicine. He's the founder and medical director of the Health Medicine Forum, a nonprofit educational foundation, and the Health Medicine Center in Lafayette. He's an author, motivational speaker, TV and radio personality, and two-time world senior singles tennis champion. That's world. Isn't that amazing? More important.
I can almost walk.
Well, at least he's healthy. And he's co-authored that book that I just mentioned. And he hosts a call-in radio talk show, Prescriptions for Health, heard daily on KEST 1450 AM, and 2 weekly cable TV shows on health. He's vice president of the National Orthomolecular Health Medicine Society that Dr. Cunyon runs, and he's earned his MD at Duke University and his BA from the University of California, Berkeley. I give you Len Saputo.
Thank you, Mike. First of all, it's a real pleasure to be here. I see a few familiar faces, and I know that there's some real geniuses in this group, and you've had some wonderful speakers here in the past, so it's a true privilege to be able to be here with you today. And there's a special person in the audience that I want to acknowledge, Alice Schenk. Bob Cathcart was a very dear friend of mine, a dear friend of yours, and certainly a member of this forum. He contributed so much to healthcare throughout his whole life, providing service, not really making much interest in how much money he made. And he serves as a wonderful example of what's wrong with our healthcare system today, but it's not just our healthcare system, it's every segment of our community, whether it be business, law, medicine, science, religion, sport, or whatever. And until we get to the root cause of what's wrong with our culture and how we operate it and what our value system is, you can forget about reform in any way, shape, or form in any area, not just medicine. So Alice, thank you so much. It's a great honor to have you here. I've been practicing for 40 years. Just about, actually in 1965, I got my degree from Duke. So I guess I'm now a rank person in the community in terms of numbers of years. And the whole time that I've been practicing medicine has been quite an experience. The first 25 years, I'll have to say, I really hated what I did. And that's why I played tennis. It was my escape from my job. I felt like I was practicing malpractice every day. And the main reason for that is because I was using so many drugs and technologies that I really didn't understand. I knew I was treating symptoms, and rarely did I take the time to explain all the side effects and complications and contraindications that are associated with a medication. So it was really out of that frustration, because I always wanted to be a doctor. But what turned out to be the case in the practice of medicine wasn't what I signed up for. I had this idea that it would be sort of like my family doctor was, where he really cared and he would talk and share and be there, come to the house and try and take care of our needs. This is what I was looking for. I was looking more in terms of being a healer than I was just to fix a bunch of symptoms with a bag of tools to treat people's ills. And I began drifting away, looking for new ways to think about medicine, probably in about the mid-'80s to late '80s. But things really slammed home when my wife, Vicki, Nurse Vicki, for those of you that know her, became deathly ill. She was having attacks of what's called recurrent anaphylaxis, meaning that she was having recurring attacks, probably in the range more than 30 of them, where she had to inject herself with adrenaline and other medicines to be able to just keep her alive, because she'd lose her blood pressure, she'd get hives, she was not able to function, a lot of GI symptoms. We did all the workups that you could do. She saw the best doctors. We came down to Stanford to grand rounds in immunology, where they said this is one of 26 cases in the world literature of primary anaphylaxis, and we have the answer for you. Just take this little pill called prednisone, and a couple of others, and it'll probably save you from having further anaphylactic reactions. Well, they were right. But after being on the prednisone for a while, you know what happens. And she began to have all those complications, and I began to freak out. And so, as luck would have it, one of my patients did a test. I was actually working in an integrative clinic in Berkeley. I've forgotten what the name of it was or who the person I was working with was, but I was trying to expand my knowledge of different kinds of practice. And so this test came back to me that one of my patients there had that I didn't know what it was. It was called the ELISA ACT test, a test that Russ Jaffe does. And so I asked the patient, you know, why do you want me to interpret this? Why did you go to the doctor who ordered it? And they said the doctor who ordered it doesn't know. They just did it because I asked them to. So I called Russ Jaffe. And Russ said, it's kind of complicated. I'm coming out in about 2 weeks. Why don't we get together and we'll have a conversation? So he came out 2 weeks later. I invited him over for dinner because I was nice enough that he would do that at 6 o'clock. At 11:30 at night, we were still talking. And the subject that finally came up with this test was, could this have something to do with Vicky's illness? So I told him the story. He said, yeah, you're starting to get it. This is a test that works different from one that's in the mainstream. But it's a test that's approved by the people who approve tests, the CLIA people, so we can do it. And as it turned out, even though we had done a huge workup at Stanford, or through the Stanford people, and the best doctors in Walnut Creek, we couldn't find one thing she was sensitive to by doing the RAS test and the skin test. And that's why it was called primary anaphylaxis. Well, this test showed actually something like 41 allergies to just about everything you can imagine, and to major food groups. And Vicky being on that diet and the treatment for the so-called leaky gut syndrome and the dysbiosis that we're all talking about led to her being as wonderful as she looks today, taking no medications at all. That was an awakening for me. And I knew that there was another kind of medicine that I wanted to learn about that had to do with cell biochemistry, to try and find out more about the nature of illness, and not just in the context of science, but in the psychospiritual realm as well, because one of my deepest beliefs is that physical disease is the body's way of expressing psychospiritual dysfunction or dis-ease. And that's after 40 years, I believe that with all my heart. And I know most of the time I can't solve that problem because I'm not God, and I don't understand everybody's psychospiritual problems. But I'll tell you one thing, I've learned how to listen to people and have them tell their story. And it's not going to happen in 7 to 10 minutes if you've got an HMO. And you're going to have to be present, because people will tell you what they have. They'll tell you almost everything, even the diagnosis, if you listen carefully enough, because they know what's wrong with them. So I learned a very valuable lesson as I went through this process of struggling for 25 years. And that's when I started to move in a slightly different direction. That led to meeting with other people who had interests in other areas of medicine as well. And I remember getting together with about 50 people in my living room one evening in the early 90s saying, we should build an integrative center. And I was really thinking, that would be wonderful. We'll get the chiropractors and the body workers and the homeopaths and the applied kinesiologists and people with Ayurveda and Chinese medicine and internal medicine and psychiatry and all these groups, and let's work together in a place at one time. And as we started talking about how we would do that, it occurred to me that I didn't know what the heck I was doing. Had no idea about the business. I didn't know what the other disciplines did. How was I going to work with them? All we're going to do is put a lot of people in the same building and we work independently, which is what most integrative clinics are today. So I chose not to do that whole program and started thinking about what do I have to learn to be able to be in a position to do this, because we've got a crisis in healthcare. Too many people are sick. 50% of America has a chronic disease, at least one. The cost is skyrocketing beyond all kinds of belief. And all this business about healthcare reform, which we'll get to, has nothing to do with healthcare reform. It has to do with economic reform. So what you're going to get from Washington, D.C., I can tell you, I spent a week there a week ago talking with a lot of people and a lot of organizations, is a lot of BS. and nobody's oriented to doing what needs to be done, but what they think is the right thing to do to save the country economically. So we're right back where we started. Plus, you look at not only the fact that Western medicine doesn't work that well, and that it costs too much, but it's not that safe. There was an article, I mean, many articles written in the mainstream journals, but the best summary I saw was an article called Death by Medicine by Gary Null and a couple of physicians. And the total numbers he came to, and I'm not a great fan of Gary Null's, but I think he's on the mark here. He thinks it's close to 1 million people a year are dying at the hands of things that happen in Western medicine. I'm convinced he's right. And when I looked at one paper that reviewed 154 strikes, 154 strikes where doctors weren't working, what happened is the death rate never went up. It usually stayed the same, and a lot of the time it went down. That doesn't prove anything, but it opens up your eyes to what's happening. You look at some of the things that have gone wrong in medical practice today because it's too aggressive. It's too technologically oriented. It is not preventive. It is not trying to teach lifestyle. It's trying to fix you after you're broken. That kind of system cannot, will not, never will be primary care. I would rather go to a naturopath who does think that way. I'd like to see them trained a little bit more broadly and have some clinical experience, but I think that's the style. And I think there's a whole orientation to how we should be thinking of how we treat patients. And it follows a certain hierarchy. Always but always start with lifestyle. Diet, exercise, stress reduction, sleep, weight, meaningful purpose in life, something that doesn't come up in our vocabulary very, very often. But what good is it to have a perfectly functioning body if you don't know what it's for or what you're supposed to get out of it? So it's a big deal to look at lifestyle first. If that doesn't work, let's do something that's non-invasive. There are lots of traditional medicines like Chinese medicine, Ayurveda, Indian medicine, body work, psychology, life coaching. All these things are wonderful, non-invasive things that aren't going to hurt anybody ever. If that doesn't work, let's get radical. Let's try a vitamin pill. Or let's try some kind of supplement or herb. When we look at the number of deaths that there are from drugs in this country, it's about 400,000 a year. Most of us remember that old September article in 1998 that came out in JAMA that said there were 106,000 deaths every year from the expected side effects just in our hospitals, not outside of them. So that's the inherent tip of the iceberg. And then you look at the other problems that come up with medications from the expected side effects. Now you're looking at 400,000, and the mistakes. You're looking at 400,000 deaths a year. So when you're looking at deaths from vitamin pills, I think there's one every other year that's reported. Got to watch that vitamin A, you know, it's going to kill people. Too much vitamin D is definitely going to kill you. Is it? No. How many deaths are there from people who are taking herbs and supplements? Now you're looking at something like maybe 50 a year. Now, how does that stack up to 400,000? When I read the articles that I read, and I go to a lot of the seminars that I've been to as a doctor, and I listen to the comments that are made about complementary and alternative medicine, it about drives me wild. Because I'm saying, clean up your own kitchen, you know, with the big numbers before you start talking about the horrible things that we're doing with herbs. Yeah. It's like another scale. Okay, so if the lifestyle, the non-invasive therapies, and the vitamins and minerals and herbs don't work, let's try a drug. There is a place for them. And you don't want to discount the value of medicine. You'd have to be an idiot to throw out all the wonderful things that we have in Western medicine. The gene therapy that's coming up, the stuff that's coming up with stem cells, the amazing surgeries that are done with microdissection, the fantastic things that we know. They are wonderful, and you want to use them when they're appropriate, but not first. You don't start out with a sledgehammer and something that can be fixed with a little screwdriver. So you got to think about what you're doing. Now, if that doesn't work, now you're talking about the radical things we do, the surgeries and some of the technologies. But that's the order that we should be thinking in. And unfortunately, that's not what's happening. We don't have a level playing field. We don't have medical freedom. The U.S. Constitution says nothing about medical freedom. And that's why people can be forced to do different kinds of therapies. The kids with the medulloblastomas that are being forced to do the surgeries, the chemotherapies, and whatever else they're doing at places like UCSF and Stanford and every place else ought to be ashamed of themselves for not remembering that there's a guy named Brzezinski who's doing some stuff with anti-neoplastons that I know works because I've seen his patients. I was at a conference in 1998 with Vicky up in Seattle, met Brzezinski, and met two of the children who were hemiplegic and worse until they used his treatment. Now that's not a conventional therapy. Yet, the parents can be forced to have the children do those therapies. And there are many cases like that. We deserve to have a level playing field where we can pick any kind of therapy that we want. If I want to go to an acupuncturist or an Ayurvedic practitioner or somebody that's doing somatic psychotherapy or whatever it is that I want to do, why can't I do that? Why doesn't my insurance cover it? Why doesn't the government program have something in Medicare that does something more than just a token? Why don't the medical schools do something more than have a smokescreen that says, yes, we have a Thrive program like Permanente does, which is a lot of talk. When you look at the actual amount of complementary and alternative therapies that are done in the mainstream, it's minuscule. And it's because nobody can afford it. Even though we're spending more out-of-pocket dollars on complementary and alternative therapies than we are on mainstream therapies out of pocket. And there were more visits made. This is 1998 stuff. This was published by the Harvard guys in 1998, saying that we're making more visits to CAM practitioners than to doctors. And why is that? We're losing confidence in them. People are not happy with what's happening. And the mainstream is adamantly sitting there saying, oh yeah, but we're the best, and we know all that we're supposed to do. I remember going to a conference at one of the local hospitals when I had the silly audacity to meet with the oncologists to talk about complementary and alternative therapies for cancer. They couldn't wait to have me get there. They were drooling. They had their sights set right on me. And there were about 30 or 40 people there and me saying that I think there's another way to look at things besides just the way that we're looking at them in Western medicine. And as I started my talk, they said, you know, Len, we practice medicine because we have good science. And complementary and alternative things aren't even studied. So how would you know if they even work? And I said, I was prepared for this question, and I have 3 articles for you. Don't shoot the messenger. These are published by the Office of Technology Assessment in 1979, by the Journal of the American Medical Association in 1991 or 2, and by the British Medical Journal at about the same time. And they studied this question. How much of what we do in mainstream medicine is based on good, solid science? And so I asked them, because I wasn't just going to volunteer that information. I said, what do you think? I said, you're the oncologist, what do you think? They said, well, it's got to be in the realm of maybe 90% or maybe 95%. And another guy said, well, maybe it's only 85%, or maybe one guy said 70%. And I said, well, you're going to have to read these articles because you're not going to believe the number. It's exactly the reverse of what you thought. It's 15%. That's how much great science that there is in medicine. And there's a reason for it, and I'll talk about it in a minute. Then I said there's one other thing that I want to bring to your attention, since you think that what you do is so superior to what other people have done for centuries to treat certain kinds of conditions, including cancer. And that's it. How good do you think your research is? What percentage of that do you think is good, solid science? And they said, well, now we know it's got to be 95%, maybe 99% or something like that. And I said, once again, you've got it exactly backwards. The number was 1%. Now, even I was in disbelief of that because I was trained at Duke. I was ready to go to NIH to become a research scientist. And if it wasn't for some family issues at the time, that would have been my career. So we're looking at something that's not so solid in science. Is complementary and alternative medicine any different? You wouldn't know, except it's been around sometimes for thousands of years. That says something to me. At least it passes from generation to generation because somebody thinks it works, and it might. So why is the research that's in the mainstream so bad? And is it just me telling you this? Marcia Angel, she's the editor-in-chief for 2 decades, New England Journal of Medicine. Catherine DeAngelis, for a decade, the editor of JAMA. Ushma Neal, the editor of the Journal of Clinical Investigation. They all quit their jobs within the last 10 years and came out with statements saying that they were disillusioned, disappointed, and dismayed that the information coming across their desks for publication was so pathetic. And they left. And they wrote books. And this is what they're talking about. Who publishes the information? NIH does some of it. They have about $30 billion a year that goes for research. Big Pharma, yeah, has $60 billion that they put in. So they're twice as big as NIH. And don't think there aren't ties between Big Pharma and NIH, because there are. That means that a drug company that comes up with some study that looks at their antibiotic or their chemotherapy or their drug for whatever it is that they're doing is going to do a research study, and then they're going to publish it or not publish it, depending on what it shows. Do you think they're going to come out and say, don't buy this antibiotic, it sucks? You think an article gets published that way much? Not true. No, they don't. And when you look at who publishes what, when there's a conflict of interest, nearly all of them are showing positive results. And they're presented in ways that are dishonest and outright lies a lot of the time. And it leads to what I would call murder, because it's done on purpose. As you read this book and you look at some of the issues that are raised in it that give examples of what they do, where in some cases the advertising portion of the company sponsors the study so they can show that one drug competes with another drug from another company better. Or somebody ghostwrites it. Or they'll present the statistics in a way that looks very good. That's why these 3 people quit their jobs and said, I can't take it anymore. So we have a serious problem when it comes to our research. It's not done in a fair sort of way, and there's not much that's being done about it. The classic example is Vioxx. You probably all know about the Vioxx story, but you may not know some of the details. In 1995, and this came out in testimony, okay, at a later time, they knew, the drug company that made Vioxx knew that it had cardiac problems and it was going to cause strokes. They knew it. They willfully withheld that information from the FDA. And don't be thinking the FDA is so hot. We'll get to them in a minute. They withheld that information from the FDA. They came out with a drug in 1999, that's 4 years later, and sold it until 2004, at which time they voluntarily took it off the market because somebody said, look at all these people with heart attacks and strokes. And that's not talking about the GI bleeds and the perforations and the kidney failure and the other things that you see from all the NSAIDs, all of them. Vioxx is just worse. They knew they'd be paying about $5 billion back to the people who died or were disabled from it. But they made $12.5 billion from it. Neat business deal, right? Would you call that murder? Yes. I would too. Is anybody else calling it murder? Yes. They're all going scot-free. They're just paying their $5 million and they got their profit. Now, are all drug companies to be scorned? No. Are they trying to do some of the right thing? Yes, but who are they responsible to? They're stockholders. That's right. And so, if they don't do the job, somebody else is going to do it. If the politicians don't do the job the way they do it, another politician will come along. If somebody is in any business area, in the FDA, if they don't do it right, somebody else will come along and do it. So who's the problem? It's us. Because we're into this business system where business comes first, not service. How good is the FDA? Well, you've all read about the FDA. I don't have to tell you too much about it. But we know that probably about a third of the people in the FDA have connections with Big Pharma. When Vioxx was taken off the market, Bextra was also taken off the market, another sad non-steroidal anti-inflammatory. And a third one, Celebrex, should have been taken off as well. But out of 30 people who were on that final committee making the decision about what would happen, 10 of them were employed by who? Big Pharma. No conflict of interest there, right? Same thing is happening with our photon stimulator. As long as we're talking about infrared light tonight, might as well talk about that. We finished a clinical trial on 120 patients, and it's in the book, who had diabetic neuropathy, and we picked them from the VA in Martinez. I can tell you, those people with diabetic neuropathy had diabetic neuropathy, and they had disc disease, and they had Agent Orange poisoning, and heavy metal toxicity, and they had back problems that all can cause neuropathy. And we did an FDA-approved study. We sent it to them first and said, approve it so that we can be sure that everything will, if it comes out the way we said it would be approved by you so that this device that we were using could be patented and used in the mainstream of treatment. We had 10 investigators, many people from UCSF doing this study too, by the way. In fact, they wrote it up. So we've got 2 institutions here who did the study. They were ecstatic with the outcome. When you're talking about people with ulcers who are in wheelchairs, and you're giving them 7 minutes of light 4 days in a row, and you see changes in pain that are substantial, you see improved sensation, and improved awareness of where your feet are when you walk, it's shocking. And I know that in my private practice, I've treated many, many patients with this problem, and the ones that I see in my practice, almost uniformly, in 1 or 2 or 3 treatments, the pain is gone. The numbness is all but gone, and their awareness of where they are is gone. This technology is not going to be approved by FDA. We're going back to the FDA after 2 years and trying to get an approval sometime late in August. So I'm going to have to fly back to Washington, D.C. to meet with the FDA and find out why they're going to continue to reject our finding. The answer is obvious. If they approve that, what do you think is going to happen? It's going to cost $30 billion to Big Pharma because they won't need their Neurontin and many of the other antidepressants and other drugs that are involved in that. There's nothing crooked about the FDA, is there? So we've got some problems, Houston, and have to find a way to find some answers. Now we go back to the story that I began with. I was talking about 50 people in my living room and my not knowing exactly what to do to try and learn more about how to put an integrative center together. And what I found out of that 50 people were 6 people that I wanted to get to know better. We met in the living room again, and they were from cross disciplines. No other doctors, just cross disciplines. And we decided to just get together and talk about what it was that we did. Within 3 months, the group had 90 practitioners that were in the organization. Everybody wanted to know. And we met at John Muir Hospital where I was on the staff. And what we did with that organization in 1994 was do show and tell to try and figure out what the heck does a Chinese medicine doctor mean when he's talking about heat and stone and rain and fleece. I don't know what they're talking about at the time. But it was unbelievable to see them working in panels that we had together where we'd take a patient, we'd have maybe 100 or 150 people in the room, kind of like this, and we'd have 6 practitioners or 8 practitioners on a panel and a patient, and each one of them would be from a different discipline, and they would tell the story of how they would go about and use their discipline to try and find some answers. And I remember the first time I walked up there, because I was the moderator, right? I founded the forum, so I was going to be the moderator. I left a brown trail from my seat in the back up to the front because I had no idea how I was going to deal with that. But what I learned is if I just shut up and listened, they'd actually tell me, sort of like the patient. Yeah. And to my shock, Nearly every practitioner, no matter what their discipline was, had something to add, and most of it was geared along the same kind of thinking, same solutions. And usually, except for medicine, it started with lifestyle. That culminated in 1997 with an event that had about 200 people at Mount Diablo Hospital, where it was called Show and Tell. And we started on Friday, ended on Sunday. We had I'll bet we had 60 or 70 people who made presentations about their discipline. The spirit in that room was unbelievable. Everybody was joyous. They wanted to participate. They wanted to tell us, what is your discipline? This is what my discipline does. This is when you want to use me as a referral. I was ecstatic to see the spirit in the room. And we did it all under the guise of the role of spirit and healing, so we kind of tied it together that way. I don't know who of you knows Richard Miles, but Richard's an old sage friend of mine who knows a lot about the role of spirit and healing. He's taught me so much about how to incorporate that in my own practice. So it was a wonderful event. Then we got the idea of, well, so we know kind of what you do now. How can we work together in a way that really makes sense? So my idea was, okay, let's have a big meeting. We've got 150 people here. Let's count off by tens. So we had 10 people in 15 groups, and one person would volunteer to be the patient, and the others would be practitioners of a whole range of disciplines. And they would work with that person for half an hour, something like that, and try to see if they could figure out what was going on with that patient from the point of view of their discipline and give their advice of what they would do. Then we'd take a representative from each of the groups and come to the front and we talk. What did you learn? What was the process? Did you make some mistakes? Were there things that you could have done differently? How did you feel about what was happening? What was it like to be the patient? Well, over the course of a couple of years, we got the idea that this actually could work. And so we started doing it on patients. And over the next couple of years, we did 100 what I call healing circles, where we would take anywhere between, I'd say 6 and 8 practitioners, which I think now is too many. But that's what we did to learn about what we were doing. And we'd meet with the patient for 2 hours. We did it always for free and always for 2 hours. We recorded every session. We gave the tape to the patient when we were done. We gave our recommendations when we were through. There was a guide, a health guide, who would supervise and protect the patient from the experiences of practitioners that didn't have as much savvy as others. So it was always looking at the emotional, the spiritual, the physical, and the biochemical aspects of what was going on. And after doing those 100 circles, what we learned from that is that people really loved it. They liked the dialogue of the exchange of information in the presence of all the practitioners and themselves. All the comments were made to the patient, not to people talking to one another as professionals. And when I was a guide, if they started talking, I said, no, talk to that's who you're talking to over there. That's the patient. And this is a relationship with them. Well, the information exchange was honest. It wasn't so cavalier as it might be if you had the patient all to yourself and you're the almighty whatever you are and you're trying to take charge and have an answer. It was okay to not know. Just fine not to know because there were other people there who might know. And I remember a lot of the times being on these panels and not saying a word. And they'd say, Len, you were quiet with this. What's the matter with you? You sick or something? I say, what I have to say doesn't influence what this patient needs in any way, shape, or form. So I shut up. The importance of information exchange can't be minimized, but it's the minor part of what these healing circles do. What they really do is they move from information exchange to something called connection. Now you're talking about the thing I said earlier. Physical disease is the body's way of expressing psychospiritual dysfunction. And it does. And it's that connection that you have with your patient in that setting that speaks to them the loudest. There's usually tears of appreciation. You didn't charge me anything. You did it out of the goodness of your heart. You gave me all this information. You listen to me deeply in a sacred place that I haven't been heard maybe ever in my life. So we had invented something that's wonderful. The next step was to bring it into clinical practice. So we did. In the year 2000, actually it was 2001, in September, just after 9/11, my office burned down. It was sort of like, okay, it's time to start an integrative clinic. Thank you for the gentle warning. But my office is gone now. And so we started up the first Health Medicine Institute, we called it. We had a funder, we had a CEO, we went broke in about 6 years, 5 years. We're losing $10,000 a month. The playing field's not level. You can't get reimbursed for services that we've been talking about, the complementary and alternative services. And a lot of the services that I do aren't covered either. So people, if you're rich, come see us, we'll help you. But there weren't enough rich people who understood what we're doing to keep us afloat. So we closed it down. And I started up another center in Walnut Creek that's now called the Health Medicine Center. And it's 1,000 square feet, not 5,000 square feet. And we're trying to make the system work. I've gone through 50 practitioners. It is not easy to start a center with people who are oriented to just service first. I don't make hardly any money, Vicki will tell you, in what I do, even though my rates are ridiculous, because I have to put the money back into what we're doing. It's because I am totally convinced that the best way I can spend the money that I do have is by giving it. What good is the money going to be when I'm dead? So I'll be a wealthy guy. When I'm on my deathbed, I'm not going to look back at my stock portfolio and my bank account to see if I was a good boy. I don't want to have to bring tap dancing shoes to the gates of St. Peter when I get there. So I'm very much motivated to work that way, but it's very hard to find practitioners, particularly complementary and alternative practitioners, that will come to you and subordinate the finances so that it's not the biggest thing. And most of the complementary and alternative practitioners that I see don't have many patients. The ones that do aren't interested. They're doing fine financially. They don't need to join me. Yeah, Len, it's a great idea, and I wish I could, but I've been doing this, and I got all these expenses, and your last institute didn't make it, so right, and it goes on. A few people do. They're like gold. They don't make much money either. The tendency for most of the practitioners at the institute that we had was that they needed to have a certain amount of income to meet their needs. And that was number one. Not number two, who was number one. The service part was important, and they all had good hearts. Everybody had good hearts. But we have to look at the culture, and I would challenge each of you too. Would you do that? Would you give up your economics? Some of you would. Good. I'll sign you up later. And we'll see if it's true. Because it's a big commitment to make. And that's the problem, is we have to find a way to want to give service. Because that's what really life is about. I gave a talk on Monday night for the Health Medicine Forum on when purpose finds you. And what's that really about? What's the point of being alive? What are you supposed to get out of it? Being healthy is great because then you go through it with good health. But when you're on your deathbed, you're still going to ask yourself that question, did I do what I should have done to be the best human being I could be? I can't sleep at night if I don't do that right. And I know Vicki gets hacked off at me sometimes because it'd be nice to take a check home now and then, wouldn't it? Yeah. So the doctors in general who have good practices, who are oriented to the kind of style of practice that I like, usually if they're not close to where I am, they've got their practices someplace else. The local doctors basically don't want to learn much about it. I've had a few MDs come through, and every one of them have not worked out. And a lot of it is personalities, it's economics, it's little things. Running a business is really a big deal if you're trying to provide service as the first thing. So what I'm complaining about with you is I think we all have to evolve. Humanity has to evolve. We've got to get to a place where we're more committed to giving than receiving. Because the most important thing in life is our relationships. And it's about love and about sharing. Once we're secure with ourselves and we're authentic, and we feel okay about who we are, then we're in a position to have a healthy relationship with someone else. And if we find another person who's authentic and not playing a bunch of role games like we do with the dating scene and all the other things that we do in our lives, trying to appear that we're better than we are, but if we were just authentic in how we were and met another person like that, we could actually have a relationship. And if we had a whole group of people like that, we could have something called a community. Once we've done that, our next issue that comes to mind is, what do I do to connect with Spirit? What is Spirit? It's our connection with all that there is. And we forget about that a lot. And until we come back to that premise, where we're authentic, living in community, and connected to Spirit, we're going to continue to be on this economic drive that we're on that's taking us to where we are. And it's not a pretty scene. So the power is in our hands. Pogo was right. He was absolutely right. We found the enemy. They are us. So is it hopeless? Can you do what Gandhi said? Can you be the change you want to see? That's what it's evolving down to. What do you think is happening in Capitol Hill? Healthcare reform. We spend too much money. We've got to save on the money. Everybody's sick. Medicine is killing too many people. So what does healthcare reform mean? It means Congress has got a job to do that is incompetent of doing. Totally incompetent. I spent last week talking with lots of senators' offices and found that very disheartening. They've all got their axe to grind. They don't give a crap about us. You think they do. You're mistaken. What they care about is their next election. And where do they get their money from? Okay? They get a lot of it from Big Pharma. They get it from a lot of other places that are corrupt as well. The insurance industry has a stranglehold. I mean, the insurance companies should be embarrassed. They'll take your money. They'll try not to give you services. They will skim to get the patients that are the healthy ones. They'll leave the sick ones to paying premiums that are a joke. And then you do the best you can, if you can afford it. 46 million Americans have no insurance. Another 100 million people are underinsured. That's half of America. 66%, this just came out yesterday, of all bankruptcies are because of health care costs. So let's have economic reform, right? So we can all afford to have the same crappy system we've got now. We'll universalize it. Everybody goes on the same system so that we can have universal health care. And then we can argue about who's going to provide it. Is anybody talking about health care reform? There's a little talk. They're talking a little about prevention, but I don't think anybody knows what it means. They're talking about some bundled programs where people can get a certain amount of money to try it on a city and do what they want. That's an experiment that'll take 10 years to figure out. Nobody's really looking at lifestyle as the big thing. But we are in Walnut Creek. We've got what's called the Walnut Creek Wellness City Challenge. And what are we doing there? Well, a woman, a housewife, got sick and tired of her kids having bad food. And so this is Cindy Gershon. And what she did, you go to wellnesscitychallenge.com if you want to read about it. It's a great website too. And so for about 5 or 6 years, she's been working on the mayors to try and get them to do something so the cities would sponsor some kind of good eating habits. And so she came to me and said, I don't know what to do. I'm not a doctor and I'm not a nutritionist. I've tried to do the best I can. She says, would you take this section of the organization over? So I got together and pulled in 25 people like Dick Cunyon and Russ Jaffe, and people who are pediatric endocrinologists from UCSF and somebody from UC Davis and people from Public Health Department and most of the major hospitals, including Kaiser and John Muir and the county, etc. 25 people. And we met for about 3 or 4 months and we argued about what we should do. And we came up with about 50 ideas. And I thought, great, we got 50 ideas to tell the city what they have to do. really. And then figured, well, let's reduce it to something that makes sense. And we came up with just 3 things. Just get the high fructose corn syrup and sugars out of the first 3 ingredients. Get all the trans fats out, because they cause inflammation, they cause problems with circulation, and they cause clotting, and they cause terrible membranes to form, lots of things. Yet something says zero trans fat. It's not zero trans fat. It's not like you can't get the trans fats out. You can, but you can still have a half a gram there in each serving. And thirdly, let's put some fiber back in the food. If it looks like a peach or a watermelon or a zucchini or a tomato, eat it. If it's in a cellophane package with an ingredients list, junk it. It's a food product. It's not food. It's not what you were meant to eat. In our infinite wisdom, we've created the worst diets on the planet. And that's why we're having a lot of the problems that we are with our healthcare system. It causes inflammation. And that causes lots of problems. So that's what we did. And little Cindy goes to all the mayors now of the county and gets them to take a pledge. And says, I'll take the pledge. Walnut Creek did it. And then Concord said, well, you did it. We'll do it. And then somebody else did it. Now the whole county signed up on the program. And what have we done? We have shown Congress what's possible at the grassroots level. And it's the only way that we're going to get anything done, because it isn't going to happen from the top down. It's just not going to happen.
So is Congress going to take away your funding?
What funding we have? Yeah. What funding? They'll try. They'll probably put us in jail. Who knows what they'll do? But that's working. Now, what if we did that with exercise? And we actually started a program with exercise. How about we require an hour of exercise in every school, at every level, in every city, and every state? All of a sudden, we'd have good food and good exercise. And then we could start talking about what we're teaching in schools. Or you want to learn your ABCs and become a rocket scientist, or you want to learn how to live with your neighbor? We teach something about lifestyle and meaningful purpose in life and why you're there in the first place. I shudder when I see my 13-year-old granddaughter come home with her work. I was trying to find a nice word to say. With her work. That is not like it's unimportant, but it isn't the primary thing that I want her to learn. I want her to learn to be a secure, authentic human being who feels good about who she is, who's contributing and cares. It gets back to what's life about. It's about love. Love is for giving and graciously receiving. It's not for taking. It's not narcissistic. And we all love it. We crave it. And yet the way we behave, we're in this adversarial, competitive society that is antagonistic and trying to be one-upping people. What happened? Lots of big business going on that's got our brains bent. So as we're looking for things that we can do that are solutions to our healthcare problems, that are real healthcare reform, change our diet, let's do some exercise. Let's get some research on an equal footing at the National Institutes of Health for all kinds of research. Why should we just be serving Big Pharma, who's putting the screws to us and coercing our medical schools to teach the things that they know, because that's what's corrupting the next generation of doctors. And don't think that there isn't that corruption there. The statistic shows that 60% of the department chairs in medical school facilities are in bed with Big Pharma. Because what makes them a good department head? Bringing in money. If you don't bring in money, you're gone. It used to be publish or perish. Forget that. You got to publish, but you got to publish and bring in money at the same time. That's why when you get a grant, like we've applied for, we're applying for a grant from the National Cancer Institute through UCSF now with our infrared light to treat the neuropathy of chemotherapy patients. We're getting a grant. We're probably going to get a $5 million grant. And it should be that way for all kinds of research. Steve Folks here should be a legend because of the brains he's got and what he's trying to do. He doesn't make any money. He doesn't have a Fabergé shirt on.
He gives it away. He's given it away. He's helped so many hundreds of
That's
people
right.
for free.
That's right. Well, that's...
why every time I tell people you need help, call him, but be sure and pay him because he won't ask you.
Yeah, well, that's because he lives from the point of view of loving people.
Example.
He's a giver, and he cares about how you feel, and he treats a lot of patients for nothing. You don't fit in, Steve. You have to work on that. So that's another thing we can do. We can get rid of the direct-to-consumer ads. Do we really need direct-to-consumer ads? There are only 2 countries on the planet that do that. That's this country and New Zealand. I don't know what's wrong with those guys, but we're the worst.
They do everything we do.
Yeah, well, maybe... Well, I don't know. If you've been to New Zealand, it's amazing to see that's what... But anyway, that's what's happening. And so they're doing all these bogus things. I mean, what's an ad? It's a way of kind of exaggerating big time what something does and doing that at a 9th or at a 6th grade level. And then talking a little bit about the complications at a 9th or a 10th grade level so you want to understand it.
With nice music.
Nice music in the back. It causes strokes and diarrhea and heart attacks. But don't worry about it because it will fix your cramps. I mean, the purple pill. Everybody's talking about the purple pill. Remember that came out? They didn't even talk about what it was. It was just a purple pill. And everybody, what's this? Who's the stupid one spending all this money? And we all wanted to know. So we found out that all these proton pump inhibitors like Nexium and Prilosec and et cetera, were what you need. In fact, you could take that pill before you go to whatever pizza place you're going, eat the whole pizza and you won't get sick. Right? And then, is it really that safe? No. Well, it's not approved for more than 8 weeks. It's not. FDA didn't approve it for more than 8 weeks. You're not going to digest your food right because there's no acid. You're not going to absorb B12 because you can't without the acid. You're not going to absorb calcium. You're not going to absorb iron. But don't worry about it. Unless you take it for a long time, like a few years, you won't get osteoporosis. But if you do, about 45% of you will. And if you take it long enough, your risk for getting senile dementia is 18%. But it's a great pill. It's got great music. So let's get rid of the direct-to-consumer ads. What happens if we tax junk food? Ah, nice idea. We tax tobacco. The FDA may even be regulating it after 2 million years. FDA may do something. So it's something to pay attention to. So if we tax junk food, maybe we could subsidize real food. Maybe we could subsidize organic food that's grown in rich soils. Maybe we could eat food that's actually good for us. If you just fixed those couple of things, food and exercise, you're looking at 60-70% reduction in all the morbidity that we're seeing in this country. It's that simple. And what about the insurance thing? What kind of insurance should we have? Should it be single payer? Should it be something that's got private insurance? We all want to have health care. We should have health care. But what we're going to get is a big disappointment to me. It's not the kind of thing that's going to deliver any health care reform at all. We're probably going to wind up with some kind of universal health care system that will cover most of the people who are not insured now, but not all of them. Even the Kennedy plan, which is supposed to be the biggest plan we have, that's the one that's supposed to be doing the biggest thing for us. He's going to leave out a lot of people as well.
35 million.
Yeah, well, a lot of people. That's right. There are only 45 million that are uninsured. So we're going to spend more money, or we'll try it this way. We're going to treat supposedly 46 million more people, and the 100 million people that are underinsured are now going to qualify. And they're talking about Medicare for everybody. Well, from what I've read, the first thing they're talking about Medicare is cuts already. So we haven't even started the program. We're right where we are, and we're going to add all this stuff on top of it, and we're going to save money. In some places we will. The insurance companies make 30 cents on the dollar as profit. The government insurance will spend 5 cents on the dollar. So we will save something there. But it's not going to be near enough to cover the expenses of the new insurance for everybody. So that's not really going to work. That system is going to give us something like Medi-Cal for everybody. And if it turned out to be single payer, which could be a good system if there was two things. We need institutional reform, which means we need to have a way to give everybody health care, but we need paradigmatic reform as well. One without the other is not going to solve anything except the economic woes that we're now going through. And don't think that health care isn't something that is terribly expensive. As of this year, it's consuming 18% of the gross national product. We spend $2.3 trillion a year. It comes to $7,500 per person per year. And we're ranked by the World Health Organization 37th. How can you do that? You have to try to do that. We spend twice as much as any other country. We obviously have the potential to give the finest health care because we have the resources to do it, and we suck. That's because business comes first. And that's what these companies are doing that are in the healthcare business. And the corruption is at the congressional level. Better believe it. If you saw the film Sicko, I have to tell you I'm not a fan of Michael Moore. I am not a fan of his, but I loved what he's trying to do. That was a landmark film, and I want to give him my credit for that because I believe that what he showed us was exaggerated but right. And if he would have been more conservative, more people would have listened. If you be humble about the way you present something and acknowledge the good that there is in a lot of what happens, people will respect that more. It's what I tried to do in this book. So those are the issues that we're faced with. And until we take responsibility ourselves, you're not going to see any changes. You're going to be sitting in audiences like this, complaining and groaning and saying, yeah, that's right. Don't forget what Gandhi said. If you be the change you want to see, that's unstoppable. There's no way to stop that. And when we have the strength to march with our feet and our dollars and spend them in the right way, we'll have what we want in every area of our culture. But don't look at healthcare as being the first one. Like I said, we're corrupt at every level. Business, law, medicine, science, religion, sport, politics, everything. We don't live in a democracy anymore. We live in an economy. We've got to stand up and take this back because we are the people. We need health care freedom. We need an amendment to the Constitution. Don't think that is going to be coming swiftly. And we need people to represent us who are not accepting money from outside sources. There should be no political contributions at all. The platform that somebody speaks on should be what speaks to us, because otherwise the transparencies that need to be in business aren't, particularly in politics. So what we're seeing is a lot of hidden bullshit, and it has to stop. So I hope you'll join with me and try to bring some of these thoughts forward. Talk to your friends. Start what we started in Walnut Creek. If you want help, we'll help you. We're looking for outreach places to just start with nutrition. We need to take this not just to the city offices. Just because the city offices are going to change their vending machines and change what they serve in all city events doesn't mean the schools are going to do that, or that the restaurants are going to do it, or God forbid our hospitals did that. So thank you very much for listening, and I'll take your questions.
Are there any foreign countries that are doing any better than
Every foreign country is doing better than we are in those areas. But they don't have both institutional and paradigmatic reform. What they have is economic reform. Canada's system leaves a lot to be desired. I was reading some cases on the internet there. They have universal single-payer health care, which means the government pays for all insurance. Apparently, there are no other insurance companies allowed. So you will have to take what you get from the government. One case that I saw on a video on YouTube talked about a man in his 50s who had a brain tumor, or thought he had a brain tumor, and he had headaches and all the signs and symptoms, and his doctor ordered an MRI. And they said, in 4.5 months, we'll do it. And he said, well, I might die from that. And he came to the US and he got his MRI and they found a brain tumor. Then he went back and said, in fact, he said, I'll pay for the MRI in Canada. They said, no, you can't do that. You have to wait. So he came back and he said, now I'd like to have the surgery. And they said, it'll be 6.5 months or something like that. And so he came back to the US. He spent $30,000 on the operation. They found a grade 2 astrocytoma and he was cured. Those kinds of things we can't have. France supposedly has the best system. England's system is pretty good. Spain's system is pretty good. Of the industrialized countries, 19 of them, we're ranked 19th in overall quality.